in the context of COVID-19 pandemic. So we have two things to look at. One, broadly, the status of the rights of the child in Kenya. And two, the effects of COVID-19 so far on children in Kenya. Why the rights of the child first? Whether we have COVID-19 or not, the right of the child is a priority for us. And you're all aware that before March, in this country, we were focusing on monitoring the rights of the child. So even before COVID, you already had some information around how our children are doing, and then COVID complicated the matter. So we still want to reflect on where we're coming from in terms of the rights of the child. At the same time, now that we have COVID has complicated much further. So allow us to do those two things. And given that today is a Universal Children's Day, the 20th of November, world over, we are reflecting on the rights of the child. So the information we are sharing here today is information collected over time through listening to children and, of course, review of government documents. And you expect to continue doing so. Within the next 2 weeks, we are still expecting to get more information that we should be able to finalize and release an official publication. So for today, we still do not have a final publication. And hopefully after 2 weeks, then we can be able to release a final publication. However, what we are sharing today is to enable you validate based on your own practices and where you work. And of course, it gives you more insights on what features you can follow up on. So I think we can proceed now. And like my colleague from the Commission indicated, so far we've been able to talk to close to 6,000 children. The first phase, which was March to August. And if you see here, the numbers, 6,000 children. How did you talk to them? There are those that we reached to their parents, and you're able to talk to them through phone calls. There are those that were visited at home, and with consent, then they responded to the key questions that we were asking. So the most recent survey, we just did it last weekend, from Friday the 13th to Monday the 17th. Monday the 16th. In the last 2 days, we are trying to put together what the children are telling us. Now, one of the key things that we want to mention as we begin here today is that every week we hear people release reports. Institutions are releasing reports. But some of these reports do not explicitly focus on children. And you listen to anyone talk about the numbers around COVID. Yes, the numbers are given based on age groups, and sometimes we're able to say how many children have been infected or affected. When we talk about effects of COVID on children, sometimes we talk about the effect on the hotel industry, the effect on employment, and very minimal on the effect on children based on their rights. So we know there are several rights as provided for in the Constitution, Article 53, and other international human rights instruments. However, today we want to focus on a few. We want to focus on the right to food. We also want to focus on the right to health, the right to water, sanitation, and hygiene, the right to basic education, the right to participation, and lastly, the right to be free from various forms of violence. So when you go to the right to food, and that's where we're starting from. Now, the right to food, we all appreciate the government of Kenya has food and nutrition security as part of its Big Four agenda. And we will have the National Plan of Action on Nutrition. So in terms of what needs to be done, I think that's very clear. So we really cannot say that we don't know what we need to do to ensure that children enjoy their right to food. Now, given that we have the Big Four agenda that has a specific focus on food and nutrition security, and given that we also have the National Plan of Action on Nutrition, so where just a second. Okay, so we're going to proceed. So given that we have these good plans, what does it mean for children? Now, the children we have been able to talk to are the children that interact with are part of the population that are not having food. Now, we have figures here. As at last year, 2.6 million people were food insecure. Now, the same period this year, that is by July, yes, the numbers had gone down to 1.3. But among these, we had children. So you can imagine that every day, the children who are waking up and have no food. Now, without food, they cannot move to any activity for the day meaningfully. Now, one of the things that we noticed that when schools were open, most of the children were enjoying the school feeding program. And if you look at the pre-primary school children, a lot of them were getting the feeding program a snack around 10 o'clock and lunch in school. Now that they're at home, a number of them are missing from that food. So one of the things we're asking ourselves, if those investments in schools for school feeding program, and that government knows where these children live. So if the schools are open, in most of the schools, especially ASAL, there was food in school. But if schools are closed, what stops us then from taking that food to homes? Because the food was there anyway. Assuming there was no COVID, in the month of May, there are schools that would be feeding children while in school. But then what stops us from taking the same food we are supposed to feed children while in school to feed them at home? And maybe it might interest you to ask, where is the food now that children never took it? If we had resources that was put for school feeding program, and if schools were open, then children would have got food in school. Now that schools were closed, if you had food readily available, perhaps we need to find out, is it still in the schools waiting for children to open? If it is still within the schools, was it kept properly? Important to note, government has been providing cash transfer to families or most vulnerable households. And through cash transfer, families have been able to feed their children. That's the report we have. It's estimated that government reaches close to 1.1 million children through their families, meaning that when cash transfer gets to families, then families are able to ensure their children get food. However, as we see these reports that, documented report that this number of families have received cash transfer, some of the children we talk to have no idea what cash transfer is, And when you ask them, the food you got today, where did it come from? The best they can recognize is that their parents gave food. So we really need to ensure that if truly the cash transfer went to the households, we need to move forward and make sure that children also appreciate these cash transfers from government. So there's a disconnect between the level of awareness in government part and parents on cash transfer and children. So allow me to pose a question for us, and this is something that we need to investigate further. The indicators around nutrition are associated with food. So in situations where children do not get food of nutritious value, what does that mean for their nutrition? So as we talk about food, we may also want to ask ourselves, since COVID, what are the nutrition indicators in terms of data? Children who are being born now, and perhaps they're being born in families that do not have access to food, what does that mean for them in terms of nutrition? And for those who are giving food supplies to families, are we just giving food, or we are giving food of nutritious value? So let's proceed now to the right to health. Now, government has made good progress, and if you compare data in the last financial year, 2019, 2018, that's what's available. We know that data for 2019, 2020, most ministries are now doing their annual sector working group reports, and I'm sure those reports might be available at the end of the month. There's good commitment to address mortality. And you can see here, there's commitment from government around mortality. And we need to ask ourselves, beyond this data that you see in government reports around mortality, beyond this data that you see, for example, that government wants to reduce under 5 mortality rate to 45 by 2022. What does that mean in terms of resources? Are we able to connect the investment against the target? So that, yes, government would say by 2022 we want to do this. And are you able to see direct investment on programs that will contribute to that change? That's information that's not readily available. We really cannot, we can see government saying that yes, we'll reduce mortality, but you cannot see how investment translates to that. The health sector being largely driven by the activities by county governments, you may want to start looking at the data around the county governments and look at the investment in county governments around health sector. Will it contribute to this reduction that government is saying? Immunization is a critical area where progress has been made. And you can see the data we have here based on government sources. Nationally, immunization indicators are good progress. But there are some counties that the immunization indicators are bad. So anytime you say Kenya is doing very well in terms of immunization, that's fine, but we need to ask ourselves, some of these counties, what could be the problem? The government initiatives around Linda Mama is being appreciated, but some mothers have no idea what Linda Mama is. So in terms of policy and programs, we are saying Linda Mama. We talk to mothers and children, they're wondering what Linda Mama is. We've seen distribution of nets being done very well. And as such, it means that perhaps reduction in malaria could be associated with distribution of nets. However, something to take note of that we need to investigate further. We could be having immunization increasing in terms of progress, coverage, mosquitoes being managed through nets. But HIV and AIDS, we have a problem. That if you look at the data we have here, the proportion of children who became HIV positive through mother-to-child transmission actually increased. And this is government source. As at between 2017 to 2018, it increased. So we need to ask ourselves, is it increasing further? And what's the reason? So we are saying we're investing in a lot of programs for mother-to-child transmission, prevention of mother-to-child transmission, but data is showing here it increased. Secondly, another area of concern is TB. There are several cases of suspected TB cases among children that have not been diagnosed. So yes, right now, we are talking about a lot of COVID-19 testing. Let's not lose focus on TB diagnosis, especially among children. And government, Ministry of Health, is also equally concerned about this. Now, COVID being a specific risk to children, one of the things we are finding out from children themselves, that a lot of these public outreaches, a lot of these media messages are not reaching them at the household level. So perhaps someone may want to ask, the investment that has been made around COVID prevention in terms of awareness creation, how many people are now more aware of what to do? Tied to that, just before June, with a lot of people going to quarantine, there's good information to show some of those quarantine facilities were not child-friendly. And there are reported cases of children who are put into more risk in the quarantine facilities. There's evidence to show that some children whose parents were in quarantine for a long time ended up being exposed to more risk at home. So yes, we might not be talking about quarantine facilities now, but let's not forget that some violations that happened around March, April, May was associated with the issue around people getting to quarantine. So really cannot forget that. And it has to be followed up. So there are families that are saying that my children were affected in this way or that way simply because I was in quarantine. And some of them are using the word detention. They're saying we were detained. I was detained for 2 weeks in quarantine center. And when I came back, I found this happened to my children. So some of the people who went to these quarantine facilities, those conditions were not favorable for them. Some of them are deplorable. So we really cannot say that now that people are talking about home-based care, we cannot forget what happened then. In regards to the rights of persons with disability, look at the public spaces we have. We are putting washing hands points or water points for washing hands. They're not friendly. Most of them are not friendly with children with disability. We are putting sanitizers, some of them even the height. The height where the sanitizer is placed. There are children who cannot reach it. So yes, we are telling people wash your hands, sanitize, but how friendly are those facilities to young people? Now, as we are putting a lot of energy on COVID response and telling people staying at home, some people ended up staying at home and forgot to go to the hospital. Many mothers stayed at home and forgot to take their children for immunization. And here we are again. As at last year, immunization indicators, we are doing very well. As at March this year, children under 5 who are not fully immunized already, we fell back to a trap. So we really must start asking ourselves, among children under 5 who are supposed to ensure that they go for routine immunization, are we on track? Even your own children. Perhaps some of you also forgot to take your own children for immunization. So let's proceed to the right to water. And colleagues, this is a very worrying area. Wash your hands with soap all the time. we're in a country where close to 18 million people lack access to improved water supply. And if you compare rural and urban areas, close to 40% of the population in the rural areas have improved access, and 60% in urban. So what does it mean for those who do not have it? By government data, it's very clear the next year and the year after we'll still be having people with no water. So here we are today saying, wash your hands. Now you have no water. If you don't have water, sanitize. You have no money to buy a sanitizer. So whose responsibility is it to provide water to people, especially children? We talk about sanitation. Close to 30% of people do not have access to improved sanitation. And this is something that government already knows. What this means, we are at more risk of diseases in addition to COVID. So some of the diseases that we are confronted with could be as a result of minimal access to water and minimal access to sanitation and hygiene services. Now, we may need to focus a little bit more and try and find out data around diarrhea, because lack of access to water, of course clean water, lack of access to proper sanitation, we need to ask ourselves, in communities where we could be having serious diarrhea indicators, could it be because there's no water? So we had government providing water, people being given trucks to bring water. That's not sustainable. Bringing water to people every day may not be sustainable. We're actually asking ourselves, given that most schools in this country do not have water, is government going to supply water to schools every day? And here's the logic. If you are at home and government comes with a truck to provide water for you, let government then provide water for you in schools. Because the same intention of providing water for you by a truck at the home is the same intention that should apply when you go to schools. So really, colleagues, yes, we could be talking about people going back to school. Ask yourselves, out of the over 20,000 primary schools, I think they're close to 22,000, over 7,000 secondary schools, how many of them have water today? How many of them have piped water? How many of them could be having water from other sources? And I think we need to, beyond just talking about schools are going to open, we need more desks. We need children to social distance schools. Where is the evidence that you have water in schools? And we have less than 2 months for schools to open. And I can tell you for sure, unless we address water in schools within the next 2 months, we might have another crisis. Now, if you don't have water in schools, you are told to sanitize. Who is going to meet the cost of buying a sanitizer per child? And what is the unit cost of utilization of sanitizer per child in schools? So as you look at government funding to school, is there a budget line specific to that sanitation? So we are encouraging us to try and find out more. When you're in your regular work, try and find out more about water in schools. We may proceed now to the most recent conversation around schools. we like to take you a little bit 2 years around 2017, 2018. Governments talk about transition. In fact, the other day, last week, the president talked about 100% transition. That's been achieved. Now, before 2018, when you have gross enrollment rate that is below 100, it clearly means some people are not going to school. And school is not primary school only. School starts at pre-primary school. So, yes, we have made good progress in primary school. So we have good data that people are going to primary school. But where's the data on pre-primary school? And anytime the government talks about we have data for primary, ask the question, okay, this is good enough, but where's the data for pre-primary? And yes, we may want to say pre-primary schools are a function of county governments. Granted, fine, but we need the national government has a responsibility to provide the national situation on pre-primary schools. So we have to track enrollment in pre-primary school, which that data is really not clear, and then look at transition. Yes, we are talking about 100% transition from primary to secondary schools. Can you also look at the 100% transition between pre-primary to primary school? Then look at 100% transition from primary to secondary school. Nationally, we could be doing very well. However, in the ASAN region, there are disparities. So when we say we have 100% transition, can we put data by government on transition per county? It may not be 100% in every county. And we have evidence to show that there are counties where children who should have gone to secondary schools have not gone to secondary schools. The alternative being technical and vocational education, they have also not gone there. So this is something that we need to investigate. Now, look at the period between March and now. Should we be talking about 100% transition and stop at that? Or should we be talking about a strategy to ensure that children get to school, all of them, when they're supposed to get back to school, perhaps in January? So this is something, again, that we may want to interest you to look at. Now, children with disability is a critical area of focus. We don't have data that clearly shows what is the transition specific to children with disability. And disability has various forms. How many children who are blind have transitioned to the next level? How many children who are deaf have transitioned to the next level? There are children who are dropping out of schools. In our daily work, we come across many children who drop out of schools. And part of the reason why they drop out of school is associated back again to food. The children who go to school, there's no food. They go back home, there's no food. So yes, we could talk about transition, enrollment, but unless we go back to the first right and invest on the right to food, then maybe the reason why we don't have children being in school most of the time is chakula. That's what they are saying. In some schools, the environment is not conducive for learning. They will be in school, but the infrastructure. Classrooms have been crowded. That's an area you need to look into. Now, the community and parents have a responsibility to support school programs. However, the level of effort among parents is also worrying. Children are concerned that their parents are not supporting them well around their school programs. And now that we are clear on enrollment, transition, are our children learning? So once we have them in school and they have gone through the 8 years, colleagues, there's no evidence to show that people are learning. The evidence we have is that people are going to school, they are transitioning from one level to another, they are passing KCPE. The mere fact that we've passed KCPE, some of them are graduating the university, and we need to ask ourselves, are we learning? What are the learning outcomes? So we need to move away from how many went to school, how many went from primary to secondary, how many went to university, and look at the value. It's very difficult in this country to associate investment on education to outcomes. Education sector receives a huge budget, but it's difficult to demonstrate how that budget has translated to learning outcomes. So when schools were closed, government developed the Basic Education COVID-19 Emergency Response Plan. I invite you to go and look at that document. And this is why I'm inviting you to do so. The Emergency Response Plan was to ensure that certain things are done in response to COVID in the education sector. Now, that plan has very clear objectives. It has very clear targets. It was even costed. So as we rush back to schools, we must also ask ourselves, between the time schools closed, there are certain things that were supposed to be done in the Basic Education Response Plan. Have they been done? That plan was to ensure continued learning. So to what extent did learning continue? It was to ensure promotion of health and safety of learners. To what extent did we promote that? There's data to show that people were not learning. If you have 57% of households who had learners undertaking self-learning, it means clearly others were not learning. If you have 17% of households who are not using any recommended method to continue the learning, it means children in those households were not learning. We appreciate that government is saying that learning will continue from where children left. That's fine. But clearly, if 5 of you are in the same class and 3 of you were learning at home, whatever thing they were learning, when you get back to class, you cannot be the same. It doesn't matter what they were learning. Maybe someone was just learning whatever, maths throughout. So if you have 5 of you in the same class, for 8 months, out of the 5, 2 are learning. Even if it was parental investment, 3 were not. When you go back, government says learning starts where it stops. That's okay. But already there's inequality. So the two, one will be asking, where did you know this concept? The other one will be saying, I learned it through online learning. The child begins to ask, why me? How come me? I never benefited. That's already inequality. That's already discrimination. So when people go back to school, there's a likelihood of children asking themselves certain questions that for 8 months, the person who used to sit next to me was enjoying computer-based learning. For me, I had no access. Why me? Access to learning opportunity for children with disability is another area that has not gone well, that needs to be looked into. Now, the plan provided for psychosocial support to children. Please ask any child who has benefited from psychosocial support from government. The children we talk to actually wondering, what do you mean? And why psychosocial support? There are children who live in families whose parents were either in quarantine or were tested positive and they are away for some time. So as we talk about the effects of COVID, one of it could be associated with the psychological challenge that the government had planned to address. So the government had indicated that this plan by the Ministry of Education, that while children are at home, they'll be ensuring that psychosocial support is provided for them at home. And there are numbers, there are targets. As they go back to school, is there an intention to provide psychosocial support while in school? Those are questions that we are asking ourselves. Colleagues, now let's look at a very worrying area, violence against children. So here, we have looked at what the government data is telling us, and we also looked at what the children's voices are telling us. So you are aware that around, I think July this year, the government released some survey. It's called the National Survey Report on Violence Against Children. Look at the numbers. That 1 in every 2 experience violence. Before you define what form of violence, meaning if you had 50 children here, what it means that 25 of them have experienced a form of violence. And that for every person who is here, 4 out of 10 female might have experienced physical violence at childhood. So this report is available, but we wanted just to bring it out before we go to those recent data. 3 in 20 females and 1 in 20 experienced sexual violence. And that about half of children in Kenya are witnessing violence at home. So the population of children in this country is close to 21 million, so meaning that around 10 million are witnessing violence at home. And that 1 in every 4 are victims of child marriage. And in terms of FGM, if you talk to people between the age of 15 to 49 years, 1 out of 5 of them, especially in the communities that practice FGM, are undergone FGM. Now, this is something that I want to ask ourselves to track. The president made a commitment to end FGM by 2022. We have 2 years to go. So the question would be, from the time this commitment was made up to now, has anything changed? So when we had the COVID pandemic, one of the things I want to point out here for us to be able to look into, the judiciary acknowledged the increasing number of cases on sexual offenses, and that most of those cases, the perpetrators were family members or relatives. And remember also in July, we had an uproar around child pregnancy. Now, as at June this year, we had 165,000 cases of child pregnancy. This is government source. So here's the thing. For every pregnancy, there's a male person behind that pregnancy. And assuming that if 165 cases are children, which is so, then you have 165 persons behind those pregnancies. So we have data on number of people who have been pregnant, but we have no data on number of people who have been arrested. So clearly, defilement is a violation. The fact that over 160,000 children are pregnant, it means over 160,000 people should have been arrested. And by now, we should be looking at, out of the arrests, how many prosecutions have been successful. So when the head of state, you remember in July, asked the National Crime Research Center to study this matter further, I don't know whether you have seen the report from the National Crime Research Center. If you haven't, this is what it says. That gender-based violence from January to June increased by 92%, as evidenced by the crime statistics by the police. And that 71% from the State Department of Gender, 71% of female were victims of gender-based violence. I look at the perpetrators, that young people between 18 and 33 are the ones who are doing this. Further, can you imagine a situation where cases of violations of the rights of the child have increased by 205%, according to Department of Children's Services? Now, if you look at data around violations, child neglect, child custody, child abandonment, it is increasing. Either the data is telling us that people are now reporting more. Maybe the mere fact that we have captured more information as government, as the Department of Children's Services has captured more information, it could mean that these things have been happening, but now people are reporting more. That's why there's a lot of numbers. Or it actually just means it's more and more and more. And that in this country, every day, close to 239 children are categorized as being neglected, meaning every single day there's a case being reported of a child neglect. Now, child neglect might translate into child labor, depending on the environment. The child who's neglected might find himself being employed by someone who doesn't understand, then you get that case being a child labor. A child who's neglected might then get to child sexual exploitation. A child who's neglected might even result to child trafficking. And what is child neglect? Perhaps even us sitting in this room, maybe some of us have neglected children we don't know. Now, participation, as we go towards concluding, the right to participation, the same right you have as an adult person, is the same right a child has to participation. And recognize that in this country, there are platforms for child participation. Kenya's Children Assembly, Kenya School, government, Children Government, Students' Council. Now, these platforms were giving them an opportunity to participate when schools were open. The moment schools were closed, again, participation became a problem. So what we are asking ourselves this morning, based on what children are telling us, how come when you're making decisions around public policy, people are participating virtually, but children are not participating? There's something we can do. Specific example I can give on education is that when the government was taking views from people around schools opening and all this, we're yet to see a deliberate plan to take views from children around schools opening. Maybe the government is saying schools should be open in January, but children want the schools open today. Maybe they're telling government, January in Mbali, bring it on now. So participation is very important. Remember, the primary consumers of the service called education are children. So if the consumers of the service have a way in which they want things to be done, have you consulted the consumers of the service? So you need to interrogate all these analyses people are doing that informed schools opening. Where is the voice of the child in this? Because the child is the consumer of the service anyway. So we have examples of the voices of children. Just proceed. Yes, we have some voices of what people are telling us. And you can see a child saying there, I advise the government. And this is a child talking to us, and you're not government. It means the government is not available. Because if the government is available, the child will be saying, I advise you. But now he's saying, I advise the government to enforce laws to the affected counties and do mass testing. Another one is saying, my education, since I'm a candidate, reading on my own cannot satisfy me. I need teachers to guide me at this crucial moment of my education. So this child perhaps is saying, I want to go back. You are delaying me. You are telling me January. I don't know. Maybe that's what they meant. Or they're saying, can the teacher come to the household? So a child who's crying that they need a teacher, the other is saying, I want to go to where the teacher is, which is school, or can this teacher come to me? Another one is saying, close the school until next year, when corona is expected to disappear. So whereas some are saying, I want to learn. Another one is saying, funga shule mpaka hii kitu ishe. So you never know. Maybe January, maybe some children will say, no, si hatukuji bado. That's what they are saying. Another one is saying, children are loitering around without parental guidance. The government, to ensure children stay at home and those loitering around be arrested to avoid teenage pregnancy. This is what they are saying if you talk about their voices. Some are saying the children could play a role to end COVID by making sure the young children stay indoors, teach others to wash hands. So they are saying we have a role. We can proceed. Now, here we just chose to show you, I hope you may be able to see it. It's not very visible, but this is something that is verbatim from what they told us. That the key thing that they're concerned about, number one, pale ni mask. The mask that people have that is reusable, that's what they have. But a number of children are saying, we want masks. So as they go to school, yes, the parent may want to buy the mask. But this thing of mask, no service. Meaning, a child who goes to school without a mask may not get the service. So this thing has to be taken seriously. Let me give the computation. If you have close to 18 million children who are supposed to be in school, and one mask, say you want to put it at 20 bob, and they're supposed to use one per day. So the kind of masks you guys are having here that are disposable, why are children not having disposable masks? Why are you insisting they must buy reusable masks? Why are you discriminating? Those are the questions. That you have a disposable mask for your own convenience, but the children are being told, wazazi wenyu wanunue mask ile mnaweza osha. So when you're in school, this thing of mask is actually going to create an inequality in school. I will tell you why. In the same classroom, a child comes with disposable mask, high quality. Another one has no mask. Another one comes with the same mask every day. Another one changes. So let's not take it easily that, wazazi wanunue mask. This thing, some of them are coming with branded masks. When you arrive in school, the issue of the mask might change the entire conversation, depending on how you look at it. So we have this, we will share with you this in soft copy so that you have a good idea of what it is. So the issue of mask is number one issue they're talking about, followed by sanitation. Number three is food. So we have masks, sanitizers, we have food. Then learning comes number four. So unless we address food, these guys will go to school but will say we still want food. Right? Some of them are concerned after school, they're concerned about this social distancing. Thereafter, parents have no money, parents have no jobs, A critical one, they're concerned about children are pregnant. Now we need to ask ourselves, the children who unfortunately became pregnant when they were home, when we come January, are we going to track and ensure that they get back to school? And should you find a school that's saying that you are pregnant, stay at home, what do we do? So we really must track this thing closely. Next, we have the same information categorized by what boys are saying and what girls are saying. The next one basically is around girls, what they're saying. Then you have children with disability, what they're saying. And of course, lastly, we want to show you how they prioritize these rights. So just scroll. So when you ask them, according to you, despite all these challenges, children are saying government is equally doing very well. So according to them, yes, they have all these challenges, but they're saying government is doing well. And they're saying government is doing well in as far as education is concerned. So among the children we asked, most of them are saying education government is doing very well, followed by health and food. So we must take food number one. How do you get children to say that government is doing very well in food? Because their priority problem is food. So in terms of what are we saying moving forward, just some key general recommendations. Now, we have to deal with data. And why we are saying we have to deal with data, people live in certain administrative boundaries that are categorized as either sublocations or wherever it is. So decisions are supposed to be made informed by data. So apart from this national level data we have, can we have local level data? In that data, can we have data by age group? The needs of children below age 5 are very different with the needs of children of age 10 and above. So when you're asking us, can you give us data? Please ask for data around age groups. Government needs to invest on that. You're also saying, as government tracks SDGs, we want this tracking to include specific indicators on children's rights. Don't just say health, we are doing very well, water, we are doing very well. SDG indicators, Sustainable Development Goal indicators, are so specific. So, colleagues, I invite you the next 2 weeks when the National Treasury will be issuing what is known as the Sector Working Group reports. Sector Working Group reports provides information on how government has performed over the last 1 year to inform the budget. Please look at those reports and ask yourself, where is the data specific to people? When you put money on water, how many people benefited? When you put money on health, how many people benefited? When you put money on roads, how many people benefited? Ask that question. At the local level, we have the Area Advisory Council, which we think is a good structure to continuously monitor children on a daily basis and report on how they're doing. Those who are doing very well, we thank God. Those who are having challenges, they can then be referred for assistance. Now, the county commissioners are the chairpersons of county area advisory councils. And we are asking a question. The same way Mutai Kagwe's team is releasing a weekly report or a daily report on COVID, can we get the commissioners to give us a weekly report on the situation of children? It's possible. If they can't do a weekly report, can they do a monthly report on the situation of children? And we are going to demand very soon, we need an annual report on the situation of children. Why do we need an annual report on the situation of children? Last week, the head of state gave a report to Parliament. That report to Parliament, if you look at what was provided to Parliament on how the government of Kenya is implementing international obligations, especially look at how we are responding as a country to the United Nations Convention on the Rights of the Child, you will find for yourself what is that document and perhaps use your wisdom to validate what it is. From the civil society perspective, we are concerned that the evidence given to Parliament around compliance to international obligations with specific rights of the child was not adequate. So we're also recommending that the National Crime Research Center report should be fully implemented. We really don't need to, we can't start suggesting what should be done. What should be done is already documented. So we really have no new idea. What should be done is already documented. In terms of violence, the government has a national response plan on violence. That should be implemented. And then for participation, just improve on the guidelines for child participation. So all these things we're saying, without money, we'll still just be talking. So we're inviting you to ask this question to government. Can we get national government to issue what we are calling a child-focused budget statement and ask the county governments to do the same so that we're able to see how much investment is going for programs that address children's rights? I thank you.
So thank you, Don. And I think you've executed it well. And when I made my opening remarks, I'd said, we want to invite you to walk this journey with us. And when you look at the presentation that my colleague Don has made, is asking a lot of questions. He's throwing a lot of things to you that you need to investigate. All these resources, where are they going? Where's the data? Okay? Issues of discrimination, issues of inequality, issues of decision making. In all these, where are we putting the child? So a lot of things that are really thrown back to us to ask us to let us investigate more. So thank you, Don. We'll open this for comments that will be facilitated by Susan. So if you have any comments, if you have any questions, I think we open it up at this stage. Thank you, Susan.
Okay, and at this point, we also want to recognize those who are following this conversation from virtual, from the online platforms. And as I'll give them an opportunity first to pose their questions, even as we give the opportunity to those who are present here. So we have a first question from Francis Namuju. And he asks, did the study consider children in flood-prone areas like Budalangi, which was hard hit this year amidst the COVID restrictions period? If not, what consideration in place to address the rights of children? Thank you, Francis. And another question, you didn't give your name, but you're asking what is the Kenyan National Commission on Human Rights and Joining Forces Alliance doing to ensure that the government distributes food to children homes in ASAL areas? So we'll have those two questions go forward to Samson or Elijah, and then we can ask questions from those who are physically present here. Thank you. Okay, let's go ahead then and take questions from here. Any questions from those seated here? Clarification? Yes, sir. Yes. Let me give you a mic. doing to ensure that government distributes food to children, homes in ASAL areas was from Alphonse Otiato. So I welcome Elijah and Samson to take those questions.
Thank you for those three questions. The first one I want to talk about is the food. And we are asking the question because we have some evidence that needs to be proven. The context where the food that was in school before children were told to stay at home was actually utilized to give children food at home. In their context, where children themselves were asking, the food that was in school, where is it? How can it come and reach us? So our recommendation is that can the food or the feeding program be audited? That way, we'll be able to know whether the investment on the right to food through school feeding program has been utilized well. Tied to that, the government investment in free primary education, before March, there was budget allocated that was to go to all schools. And the way the government works, every financial year there's a budget. So for us, we know that the financial year ending 2019-2020 that ended in June 30th, there was a budget for schools for free primary education. We also know that from July 1, 2020-2021, there's a budget for free education, even if children are at home. So the question is, the amount of money allocated for schools that was supposed to be utilized, where is it? If it has been utilized very well, let us see the evidence that has been utilized very well. We don't have it. We don't have that evidence. And suppose it was not utilized, then we are believing that come January, the funding to schools should actually double. Because what you save from March to October, if you don't use it on something else, you keep it and use it well in future. So as we talk about schools going to open, we need to ask these questions. Now, there's a colleague who's asking, I think virtually, did we get information from Busia County? Yes, we did. And in some of these surveys, perhaps the persons who are interviewing your children did not interact directly with you, but I can assure you, in March, April, up to August, we have children voices from Busia County. And last weekend, Friday, Saturday, and Sunday, we have data from children from Busia County. And the third question that was asked, what are we doing around these issues? Our role as Joining Forces Alliance, in collaboration with the Commission, our role is to hold government accountable. That's the best we can do. Because the primary responsibility of service provision rests with government. And that unless we see evidence on utilization of previous resources allocated, and unless we see evidence of government commitment, we will continue holding government accountable until that evidence is put on the table. With the evidence, then we can engage and see, okay, this is the deficit. Then civil society organizations that are doing service delivery then can come in to complement. But it will be good that even as we talk about COVID response, the non-governmental organizations can continue doing what they're doing because it's emergency response, but the primary responsibility rests with government. And perhaps my colleague from the Commission can add on that.
So As Samson comes up to add on to that feedback, if there are any other questions, please, you're welcome. Yes, Bwiri.
I think I just need to reiterate what my colleague Don has said, that the government, the state is the primary duty bearer when it comes to provision of services. And therefore, our work, including you as journalists, is really to hold the state to account. Now, holding the state to account is asking those hard questions that we are asking this morning. That if the food was there, if it was distributed, if it was budgeted for, how comes that it can no longer be used to access the children wherever they are? And is it going to be possible that when we open, these things are going to be available? So the state must be held to account by all of us in different fronts, okay? And as we do this, we must ask the hard questions. In terms of the food distribution, what we did as the commission is when we released our Series 1 COVID-19 report, was to ask the government to look at food distribution, taking consideration of what is happening to the most vulnerable in the context of leaving no one behind when you look at the requirement of our SDGs. I think finally is to confirm that we had voices from Busia, which I was personally responsible for. So the information that we are sharing with all of you this morning, including those of us that are following us virtually, is that it came from all parts of the country in one way or the other. Thank you.
Thank you for that feedback. Kindly introduce yourself again.
Thank you so much. My name is Thomas Will. I'm a journalist based in Kenya. I work for the World of Kenya, and also specifically I was based on children. I just want to ask about if you guys were able to capture data, especially for the kids who are going to come back to school, because some of them are joined by their own intercessor, because some parents lost jobs, and some of the boys were not able to go back to school because of the resources. And now they have not going back to school, especially the candidates, the ones in class 8 and Form 4, and now they're into the broader business. I don't know whether this research was also captured in your research, and maybe perhaps as a country, how do we also separate these teen children so that we don't just let them go into business, but still think about going back to school. Thank you.
Thank you.
Okay, my name is Juan Zoro from Total News. My question is, probably in your research, are you also asking questions to do with, because recently we've seen children dying due to COVID-19, are you considering that as part of your, is it part of your, for your research? Was it part of the issue that you factored in? And are you also factoring that in your subsequent research?
Perhaps on the final question, I would like to inform from this in Africa. We recently saw the Nairobi Metropolitan Services actually employing some of our street urchins. I'm thinking it's something you're familiar with. Now, there are certain laws which actually prohibit employment of children, but then again, these kids go hungry in the streets. So my question is actually on the basic aspects of the law. Should we still have certain laws when it seems to perhaps not make sense?
Thank you. The first question on data on COVID. The good thing is that the Ministry of Health has data by age group and by sex, and you can even find by disability. So that data is available. The data around infections and even death is available at national by sex, by age group, by disability. It's also available by county. It's also available by sub-county. Now, what perhaps we should be looking into is what are the numbers specific to certain sub-counties, and then we may want to investigate or analyze whether there's a pattern or there's a trend around deaths specific to children that perhaps we still do not know what it means. So what I would suggest is that is an area that we can take up and look at if you have deaths around children, what are the contributing factors around those specific deaths in as far as COVID is concerned. Because I've seen governments release documents talking about certain contributing factors around deaths. And as children go back to school, that's an area that will be good to take up and just analyze it much better. So that I can confirm data is available. What we need to do is just to look at it further. And perhaps you can collaborate with us on this. One of the objectives for this meeting was to look at, are there specific journalists in this room who are interested in a further engagement around going to document the issues? For instance, the children we talk to, some of them, we know up to their homes. So if the journalists were interested in going to document this, then that's one way of going forward. And if you want to document families, stories from families who have been infected by COVID in one way or another, that's an area of partnership. The second thing that has been raised here is child labor. Let's call it what it is. Yes, we can say children were employed. Children have been employed in the boda sector. All that is child labor. Now, child labor is a violation. So we need to ask ourselves as citizens, what do we do around cases of children that we see involved in various forms of harmful labor? Because they live with us. So we have a responsibility to do our part first by getting them from that environment of child labor. And two, we have a responsibility of reporting to the authorities, depending on what we see. And three, we have a responsibility of tracking that matter up to its logical conclusion. Now, the law and related frameworks are very clear on what it means child labor. And I want to invite you, if you have a case of child labor right now that you know of, or you have an area where you are seeing rampant child labor, please let's take that immediately. We didn't want to leave this meeting with cases of serious violations like child labor that we are saying we will go and ask government. We have a responsibility, the Commission is here and we are here as an alliance, to actually get to that place where we have this evidence of serious child labor and that matter is dealt with immediately. So we wouldn't want to push the responsibility to go and help children who are right now in child labor to government. We have to do our part first, and that's why we're here, and then we'll collaborate with government to ensure that's addressed. So I think the key thing here we need to ask ourselves, how many children have found themselves in child labor? There are children who have seen their colleagues being in child labor, especially those children who are in families where their parents are saying, let's go along for us to get more money. So we must also deal with what are the push factors, what is driving children into child labor. So unless we deal with that issue that is driving children into child labor, we're still not there. So we must balance between looking at the root cause as to why children are in child labor and then getting them away from child labor. Now, among the agencies that are here, we have the Commission with us, we have Child Fund, we have Plan International, we have Save the Children, Terre de Homes, SOS, and World Vision. All these agencies, I would have showed you, if there's time, our spread in the country. We have direct contact with communities where we work in 143 sub-counties, spread across 41 counties in Kenya, meaning if there's a matter in a particular sub-county where we are present, then that matter can be raised and given to us immediately. The Commission equally has networks. So that's part of the strategy for getting information and helping us also to respond in good time. So today being the Universal Children's Day, we want to interest you to walk with us a journey of monitoring and tracking children's rights. And that if there's some of you who are keen on that area, then it's perhaps an area that you can have regular conversation. Beyond us coming to present you information, we can collaborate in looking for that information together, depending on the various contexts. Like I've told you, in all those areas where we work, it only takes the two parties to agree what information do we want to collect together. Then that's an area of collaboration, and we are very ready with agencies that are interested to go that direction, so that we move away from Joining Forces Alliance and the Commission speaking to you. But we'd love to see a day that, in collaboration with the media, we'll be saying the civil society, in collaboration with the media, is saying this. So if there are any other questions, we can take them. If there isn't, we bring this to a close. In the next 2 weeks, the Commission and the Joining Forces Alliance will now formally be releasing the final publication of this study. It may come by way of an advisory to various government ministries. It will also come by way of an official press statement. So because we have your contacts, I'm sure you have all your contacts. When that is ready, then we'll invite you again for the formal release of part of our findings. And from 25th, you are aware we are working on the 16 days of activism. For meaning clearly, between now up to around 10th of December is the International Human Rights Day. So we have a series of things that can help us to maintain the advocacy agenda for the next 3 weeks. And that's the only way we can hold government accountable. And we also are available for government to hold us accountable. We thank you, and if there's nothing else, Susan, I think we can bring this to a close. Thank you very much for coming, and those who are listening virtually from wherever you are, we thank you. I'm told there's one more question.
Yeah, so we have one more question from Alphonse Otiato again. So early pregnancies is rampant across the country, and the perpetrators of the same are walking free from judicial process. Can we have a policy or acts on sexual offense, children acts, shift and change the Bill of Rights to include castration of the culprits as a deterrent measure?
This is interesting. I think the legal framework and the policy framework to deal with these things is available. What the challenge still is enforcing some of these frameworks. So clearly, we need to do more at the community. There's what we call the child justice system. Perhaps we need to do more at the community level. But I think for feedback to him, like I said, if you have 165,000 cases of pregnancies, we must be sure there are 165,000 people who have been arrested. And unless we do that, so another option is what we call citizen's arrest. In situations where in a community you are clearly seeing this is a perpetrator, and for the last 2 weeks no one is arresting him, citizens can arrest. We organize ourselves, we get the person, we take him to the police station. If he comes out, we get him again, we take him to another level. We must do that, and we can do it. So I encourage you, those who are listening to us, in communities where you have these cases and you have challenges, I want to mention again here in Bungoma, I think 2 days ago, there's a similar case where a parent went to the police station to report, and there's a problem at the police station, and we are dealing with that. So we are able to deal with them. The Commission can confirm that that support is available.
Thank you, Don. I think for me, my final remarks is to make a very passionate appeal that you as journalists are human rights defenders by the virtue of the work that you do. And the appeal we are making this morning is very few of you cover children affairs because it's not an interesting area. We all know the interesting things in Kenya. One of them is politics. Now, children affairs are not interesting matters. What I'm looking at this morning, Don, as joining forces and the Commission is I would want to see us bring together a network of journalists that are keen on covering just children affairs. And we can take this conversation further by even a form of even doing some training that would build your capacity in terms of what is required when covering children affairs. What is it that you need to do? Where can you refer cases when they happen? Where can you get immediate help? So for me, my appeal to you this morning is, this afternoon, is really walk with us this journey. Let's see how we can form a network of journalists that are strictly interested in covering children affairs, so that the rights of children are given the prominence that they deserve. And all of this is in the context of leaving no one behind. So asanteni sana, and I think we bring this to a close at this point. Oh, Susan, thank you.
Yeah. So thank you, Samson, for that feedback as well. We still have 2 more questions from those who are watching virtually. Actually, 1 more question. So you ask, how can the Commission and other authorities ensure that the area advisory councils are effectively engaging the stakeholders at the sub-county and county level? Some of us are working in the sector. Some of us working in the sector have challenges due to indifference of the area advisory councils. You pose again that another challenge in Kwale is that the children officers, particularly in Matuga and Msambweni sub-counties, have overstayed, making them easily compromisable by perpetrators of child abuse. So thank you for that question. Elijah or Samson?
Okay, thank you. For those who are listening who have asked that question, let me clarify. The chairperson of the Area Advisory Council at the county level is the commissioner. At the sub-county is deputy commissioner. At the ward is the assistant county commissioner. It goes down up to chief and assistant chief. And all these are administrators under the Ministry of Interior and Coordination. So the media and journalists who are here, the issue of the functionality and effectiveness of Area Advisory Council starts with the Ministry of Interior. So we have what we call guidelines for the operation of area advisory councils. So we need to ask, in terms of performance contracting on targets, how many chiefs are consistently managing area advisory council? How many commissioners have documentation of their area advisory councils? So I think for today, let's pick the issue of area advisory council as a critical matter that should be addressed by the CS, Dr. Matiani, because the chairpersons of those are in the ministry in collaboration with the CS for labor, because the children officers are also the secretary of this area advisory councils. The area advisory councils guidelines are being revised. So once those guidelines have been revised and finalized, again, you might find a new direction on how they are going to work. In terms of the human resources, we hear you. The concern here is that some government officials or children officers have stayed for a long period in their stations. We take that up and we'll be able to follow it up and get the facts around it.